There's a lot of chat in fertility socials about the AMH and a huge focus on that dictating your chances. But are there any other markers that women need to consider to get a clear picture of their fertility?
Well, every woman should know that AMH has never been shown to be demonstrative or predictive of fertility outcomes. So there is not a single study anywhere that shows that your AMH can predict whether or not you're going to conceive. It is solely a marker to guide you to understand A, how many eggs you will likely produce. It's reasonably predictive of that. And B, how close are you to menopause? And it's quite predictive of that. But that is all your AMH is good for. Now, do we use it as a surrogate to help us ascertain how the patient's going to do? Can it be useful in terms of guiding the patient and determining how many cycles they will need? Yes, because it tells you your egg reserve or your ovarian reserve. And if you look at new AI generated excuse me, platforms for the determination of the number of cycles it'll take to make euploid embryos, AMH is in those, and it is a key factor, a key determinant. From the standpoint of other markers, your antral follicle count, the number of follicles you have at the start of your cycle, is also a very good and important gauge. And it's important to note that the AMH does not always synchronize the antral follicle count. You do have women that have a very low AMH but have a decent antral follicle count and will respond differently than their AMH would suggest. Your FSH can also be used to some extent, although it's not very sensitive or specific. So we can look at the level of your FSH, and certainly if it's getting higher, over 12 specifically, we're going to be more concerned about the function of the ovaries and the responsiveness of the ovaries. Your estrogen level is a very weak predictor, but can also be integrated into that. And then people are working on other markers now, like inhibin and some other activin inhibin, and using those to determine, can these also be integrated into new models that we can use to kind of predict outcomes.